has 27% of adults who are considered obese. It's less than Kansas's rate of 29%, but it's more than the 25% overall for the nation. The main problem is that too few Douglas County residents are actively engaging in physical activity and in eating healthy and nutritious foods. This results in many adverse health consequences such as chronic heart disease, diabetes, certain types of cancers, hypertension, and for obesity and even malnutrition. Some of the mediating factors, some of the influencing factors behind the obesity rate in Douglas County can be found in poverty, peer influence, and in parental involvement. What some of the data have indicated, not just in Douglas County but in general, is that these three factors play a major role in obesity and in overall health promotion in regard to physical activity and nutrition. Douglas County CHIP was founded through a collaborative effort involving multiple sectors in the community. In particular, several health organizations, such as the the Lawrence Memorial Hospital. Currently, they have partnerships with 15 organizations in Douglas County, and the overall goal is to address health outcomes and promote healthy activity. There are several task forces currently, such as the access to healthcare and physical activity and nutrition, and they're also going to be starting one focused around mental health and quality of life. The vision is creating a healthier Douglas County, and the mission is to use research-based data and collaboration to develop strategies to improve the health of Douglas County residents. And to that end, they have actually multiple activities related to physical activity and nutrition, but two that I'm just going to briefly discuss are the Get Moving program and the annual Walktober program. The Get Moving program tracks leisure time physical activity in youth, and it uses a token economy or point system, and they can redeem those points for pool passes or for passes to the bowling alley. And they also get extra incentives or extra points if they include friends or family members. The annual Walktober program encourages Douglas County residents of all ages to engage in physical activity through walking. And what they've done is they've developed a series of walks or walking trails throughout the Douglas County area that consist of at least a mile or more. And the reason this is done in October is because October is considered National Walking Month. So for my practicum experience, I wrote a county health assessment, which essentially serves as a state of the community. It provides a detailed description of the health outcomes for Douglas County, and it focuses on three domains, as I stated earlier. One is access to health care, the second one is physical activity and nutrition, and the third one is mental health and quality of life. And these domains were identified based on roughly 50 indicators. This health assessment supports CHIP's goals by providing a tool that can aid in the development and implementation of new programs and to support existing community programs such as the Get Moving program. For the methodology, I looked at data tables, data sources from a variety of places, such as the Behavioral Risk Factor Surveillance System, or BRFSS, county health rankings, the Communities That Care Survey, the U.S. Census Bureau. I also looked at the U.S. Bureau of Labor and Statistics, the Kansas Department of Education, the Federal Reserve Bank of St. Louis Economic Research for unemployment data. That was a very interesting data source. And as far as databases, I focused primarily on three. One was the KU Workgroup's Community Toolbox, the second was the CDC's Community Guide, and the third one, which was very interesting, was the Public Health Agency of Canada. Canada's public health system is excellent, and they are doing a lot of innovative and very rigorous studies. So I found that the Public Health Agency of Canada has a great deal of resources, not only for Canadian interventions, but they also include interventions conducted here in the United States, which I thought was very nice. So just some of the data that I found for physical activity and nutrition. As alluded to before, more than half of the residents in Douglas County are inactive, meaning they get less than the recommended amount of physical activity, which is 60 minutes a day of 60 minutes of moderate to vigorous physical activity for youth, and about 150 minutes a week for adults. And less than 20% consume the adequate amount of fruits and vegetables a day, which is 5. With this graph is indicative of the percent of physical activity from 2007 to 2009 for Douglas County. So even though in 2009 there were more than Kansas, it's still not that much different overall for the state. And we can see that there's only about 83 or 84% of Douglas County residents are actually participating in physical activity. This graph indicates the adequate fruit and vegetable consumption per day for Douglas County and Kansas. And as you can see, Douglas County has been on a decline from 2007 to 2009. And 2009 was the first year that Douglas County had less rates of youth and adults in eating the adequate number of fruits and vegetables compared to Kansas. And I found this very interesting. I did not expect to see this decline in Douglas County, especially compared with the state data. So the analysis. For the analysis section, I did an assets, barriers analysis and looking at targets and agents of change for both physical activity and nutrition. Some of the assets for physical activity include sports venues, sports facilities, community events such as the Red Dogs Dog Days, public athletic clubs and gyms. Some of the barriers, though, include misconceptions of what constitutes physical activity. Some people equate physical activity with exercise, meaning I have to do push-ups and sit-ups and jumping jacks, when physical activity could also mean going on a brisk walk with your friends, parking farther away from the door when you're going shopping. So all those things are part of physical activity, but many people don't think that they are. Also, one of the other barriers is that people have indicated that there's just not enough, there's no time to engage in physical activity. A lot of people, based on previous focus groups, have said that they think that physical activity has to be done all at one time. So it all has to be done in one 30-minute block or in 1 hour block, instead of breaking it up. And the CDC actually says that time can be broken up. So getting 10 minutes of physical activity here, 10 minutes there, things like that. And also, some people are just self-conscious about engaging in physical activity in public. So some of the targets and agents of change for physical activity include physical education teachers, government, nonprofit organizations and coalitions, even religious and civic organizations, in that they can support physical activity and nutrition-based programs in the church or in the places of worship. For nutrition, some of the assets are farmers markets and grocery stores. There are several farmers markets here in Lawrence. And there are also whole food stores, some ethnic stores. There's a world market here in town. But some of the barriers is that the healthy food is not readily available to all Douglas County residents. And the food is just too expensive. And also, there's a misconception of what healthy nutrition is. A lot of people don't know how to read the nutrition facts. So that's another barrier. Some of the targets and agents of change are a lot like those for physical activity. But in addition, we can also include grocery store owners, farmers, people who are stakeholders in those areas, and also community health educators. I wanted to include this asset map that shows these are all the grocery stores in Douglas County. So we see that there are some in Baldwin City, Eudora, Lecompton, but we see that most of them are here in Lawrence. So because most of them are here in Lawrence, it may pose a problem for those who have mobility issues or who don't have transportation to get those fruits and vegetables from farmers markets, because the farmers markets are all located here in Lawrence, which I also found surprising. There were some evidence-based practices that were identified in the community health assessment. For physical activity, one was simple prompts for stair use, to place a sign or some kind of marker next to an elevator to promote stair use. And also modifying school policies and curricula to increase the number of minutes that youth are engaged in physical activity at school and PE classrooms, and not only engaged in activity in the classroom, but also lengthening the time of physical education. And also promoting more moderate and vigorous activity in school curricula. For nutrition, I found two very interesting ones. One was the British Columbia Farmers Market Nutrition Coupon Project. And it was a very simple intervention that went on for about 6 to 8 weeks. And with this intervention, low-income families and pregnant women were provided with $15 coupons per week to use towards obtaining fresh fruits and vegetables. The Teens Intervention stands for Teens Eating for Energy and Nutrition at School. And it focused on there were several components, such as family orientation intervention, information packets, skill building and decision making regarding selecting healthy foods, and also modifying school food service policies in schools. So it had more of an ecological approach to it, in that it covered several of the components that we learned about in ABSC 310. Based on the review of the strategies, I've proposed a few strategies that may be relevant for Douglas County, such as extending the hours of gym operation, providing discounts for family or group memberships, and also walking groups. For nutrition, I propose extending the hours and availability of farmers markets, particularly providing a way for the fresh fruits and vegetables in Lawrence, from Lawrence farmers markets, to be made available to those residents in Eudora, Lecompton, and Baldwin City. And also to provide some kind of incentive or subsidy for people to grow their own fruits and vegetables. In the future, this community health assessment will actually be presented to the CHIP leadership group in August, actually in about 3 weeks or so. The task forces and the leadership group plan to use this assessment to inform their future actions. They're actually going through a rather significant restructuring, not from scratch, but they're revisiting their mission statement, like the task forces are revisiting their mission statements, things of that nature, and they're going to ground it heavily in the community health assessment and in the goals for Healthy People 2020. Some of the next steps include conducting more focus groups for fall 2011. Actually, in about October and November, they plan on conducting additional focus groups, much like the ones that were conducted in the spring, and also expanding the Get Moving program. Currently, the Get Moving program focuses on elementary students. They want to expand it to include middle and high school students. And perhaps an adaptation of the British Columbia Farmers Market program that I discussed earlier, to see if there is a way that it can be adapted for Douglas County, because it is a rather simple intervention that's short. Some personal insights. Doing this study, or doing this practicum experience, I learned how to write better to a target audience. I initially started writing this assessment as an academic paper. Then I realized, well, not only did I realize, but Dr. Thompson and Janelle realized that that's not the intent. And so it really forced me to think about, as I was writing it, how would the leadership group read this? Or how would they interpret what I'm actually saying? a lot of times one of the problems I had was that I knew what I wanted to say, but could not quite find the words to say it to get my point across concisely.